We're going to talk about veterans and their health care. And with us today, we have an expert from Humana in this field, Aaron McCoy. And Aaron's going to spend some time going through how to work with veterans with their health care in the Medicare space. So, Aaron, if you're ready, I'm going to turn everything over to you.
Sounds good, Bob. Thanks for having me this afternoon, and I'll jump off real quick just with a quick intro, and we'll jump right into the content and information. I was on our veteran team for many years. I recently transitioned to the broker relationship manager role in Ohio. I'll share my teammates real quick on the next slide. I'm an Army veteran as well, but done this training many times over the course of 6 years. Hopefully this will be helpful for everybody. That's my contact information, my email address specifically, if you need anything that comes up after today's training. My counterparts just for the state of Ohio, and I believe we have folks outside of just Ohio, but just to orient anybody who's working in Ohio, this is our Ohio broker relationship team at Humana. Myself, Mike Goldsmith is my counterpart, and Sherry Thomas is our broker relationship executive. She's really on the phone behind the computer at all times, and Mike and I are in the state, traveling around the state on a pretty regular basis. But I'll get past the intros and just jump into what we're going to discuss today, because I know we got about 44 minutes till we hit the top of the hour. So I want to make sure that I get in all the information that we're going to cover in the training, the webinar this afternoon. So really the goal of today is to make sure that you are familiar with and understand and kind of are on your path to being that subject matter expert when it comes to assisting veterans and their families with their Medicare needs. And really the main information you need to understand to be able to do that are the 3 types of healthcare that veterans and or their families, for our purposes, really their spouses, oftentimes have access to and either works alongside of or in conjunction with Medicare and Medicare Advantage products. So we're going to talk about VA healthcare, TRICARE for Life, and CHAMP VA. We'll do VA healthcare first. That'll be kind of the longest section, and then we'll close out with TRICARE for Life and CHAMP VA, kind of right back to back because they're very similar in how they work, and I'll reiterate that as we get closer to that section. But VA healthcare is generally going to be your largest opportunity just in terms of the number of veterans that have VA healthcare. It's going to be, quite frankly, in my opinion, your best opportunity when it comes to Medicare Advantage sales, and I'll kind of explain why that's the case. So let's talk about VA healthcare first, and a few kind of high-level pieces of information that you're going to want to understand about VA healthcare to help you, again, kind of really be that subject matter expert when you're sitting down across from that veteran discussing their healthcare options and their Medicare options. So VA healthcare, a few things to understand. One, it's a benefit. It's not technically speaking insurance. I'll kind of explain why we make that distinction in an upcoming slide. Second, it works like a big HMO. So when you think of VA healthcare, just think of a big HMO. You've got a primary care provider, you get referrals to see specialists, you stay within a network. But that's how the VA healthcare system operates, like a big HMO. And then the third thing, which you're going to hear me say a lot and probably get sick of me saying it, but it is completely separate from Medicare, and it's completely separate from Medicare Advantage. So we're starting here with VA healthcare. Remember, with VA healthcare and Medicare or Medicare Advantage, there's no primary, there's no secondary, there's no balanced billing, nothing like that. These are 2 completely separate things. So it's really important to understand that, because that's how you're going to want to position the value of Medicare and Medicare Advantage for our purposes, is it being separate and outside of the VA healthcare system and it not needing to coordinate at all with the person's VA healthcare. So really quickly, it is good to understand that just because you're a veteran doesn't necessarily mean that you have access to the VA healthcare system. So I am not going to attempt to make you an expert on what qualifies or makes a veteran eligible for VA healthcare. But I'll tell you, generally speaking, it depends on when you served, how long you served for, and then after those eligibility criteria are met, and then it also depends on, do I have a service-connected disability? So some type of injury or disability that was caused during my time in the military. Doesn't have to be overseas, could be in training, could be stateside. Or what is my income? So length of service, time of service, disability rating through the VA specifically, VA disability rating, or income. Those are all different criteria that go into determining whether or not a veteran is eligible and qualifies for VA healthcare. What I would tell you as an agent is that if you're talking with a veteran who's Medicare aged, Medicare eligible, and if they've A, never sought out VA healthcare benefits, or B, it's been many years since they've looked into their potential eligibility and qualification for VA healthcare, you should point them in the direction of looking into that benefit. And I'll get with Bob. We have a FAQ and a healthcare resource list with that, which has phone numbers and contact information on how you can point them in that direction. So that can be a follow-on to the information that's in the training today. But that's what I would generally say. Don't concern yourself with being the expert on who can and cannot use the VA healthcare system. Just know that if you come across a veteran who has never sought it out or isn't sure if they're eligible, you just want to help point them in the direction of looking into that potential eligibility and qualification. That being said, for the rest of this section, we're just going to focus on that veteran who does have VA healthcare and what does that mean as it relates to their needs from a Medicare and a Medicare Advantage perspective. So I mentioned VA healthcare is not at all considered insurance. It's considered a benefit. And really the main reason we call that out is it unfortunately is not considered creditable coverage for Part B, Bravo, of Medicare. We'll talk about the drug portion in a little bit. That's different. But for Part B of Medicare, VA healthcare is not considered quote unquote creditable coverage. What that ultimately means is that when a veteran is aging into Medicare and they're turning 65 and they're making that decision as to whether or not they're going to sign up for Part B of Medicare, which of course has a premium associated with it, if they decide to decline Part B, which they of course can do, and that won't impact their ability to use the VA healthcare system, but if they decline Part B, and if 2, 3, 4, however many years later, they change their mind, their situation at the VA has changed. They've moved to a different area in the state where the VA is not as easily accessible to them. Whatever, those are some made up scenarios. But if their circumstances change and at that point they decide they want to sign up for Part B of Medicare, they of course can still do that, but most likely that late enrollment penalty for Part B is going to be waiting for them. Unfortunately, having VA healthcare doesn't allow them to avoid that late enrollment penalty. And that is one of the reasons that the VA itself recommends that veterans maintain both Parts A and B of Medicare. It gives them options outside the VA, of course, but also they're aware of the fact that if they change their mind, that late enrollment penalty is waiting there. So this is good to understand as an agent so that you can be a part of helping educate any veteran that you come across at the point of making this decision, hopefully, so that they understand that if they do decide to decline Part B of Medicare, that that late enrollment penalty is going to be waiting for them later on down the road, so that they want to be aware of that. They want to be educated on that so that the decision they're making is one that they're making eyes open, so to speak, and understanding the full ramifications of declining Part B of Medicare. So for the rest of this section, we'll whittle it down further. First, we talked about, hey, who can go to the VA, who has Parts A and B, taking Part A and B. But now let's really just think about that veteran that has both Parts A and B of Medicare and also has VA healthcare. And let's talk a little bit about priority groups within the VA healthcare system. So you may or may not have heard of the term priority groups, but every veteran who is enrolled in the VA healthcare system is assigned to a priority group. There's generally 8 different priority groups, and all different sorts of criteria goes into determining which priority group you fall into as a veteran. One common misconception is that your priority group determines how quickly you get access to care at the VA. That's not true at all, really. That's not what your priority group has. That's not why your priority group exists. What your priority group does determine is what, if any, out-of-pocket cost you have when you utilize the VA healthcare system. So some priority groups might have a copay when they see a doctor or get a prescription filled at the VA, and other priority groups don't have a prescription copay or a doctor's visit copay when they go to the VA through the VA healthcare system. But that's ultimately going to be determined by your priority group. The good news as an agent is you don't need to understand every single priority group, and realistically, you don't even need to worry about asking a veteran which priority group they're in. And one of the reasons I say that is because as a veteran who used the VA healthcare system for a while, I never knew which priority group I was in. And that's not uncommon for other veterans, that they may not know which priority group they're in. So the conversation you want to have around a veteran is not around priority groups, but it is important to understand that they exist. But the conversation that you do want to have and the questions you do want to ask is about what, if any, copays they pay when they utilize the VA healthcare system. So again, some veterans are going to have a copay when they utilize the VA healthcare system. Other veterans are not going to have any copays when they use the VA healthcare system. And that is really kind of the conversation that you're going to want to have. You want to ask that veteran, just like you do with any other client, hey, what do you like about your current plan? What are you paying for in your current plan? What are your copays right now, right? You want to ask similar questions of a veteran as it relates to how they utilize the VA healthcare system. Hey, do you pay a copay when you see a doctor, when you see a specialist? If you've had to be hospitalized or have a surgery at the VA, did you pay anything for that? You want to ask those same types of questions because that's going to help you understand how they're utilizing the VA healthcare system, and it's going to help you walk them down the path of figuring out, okay, what are your needs from a Medicare perspective? Do we want to at all look at a plan based on the copays it has for doctor's visits and other things, or based on your copays and what you pay at the VA, maybe that's nothing. We're really going to hone in and focus on the additional benefits the plans have to offer in your area. But this kind of gets you starting down that path to have that conversation. Oh, skipped a slide there. And a part of that conversation should hopefully be around prescription drug coverage. Excuse me. Now, if you're a veteran and you're enrolled in the VA healthcare system, you have creditable drug coverage for Part D. So somewhat counterintuitive if you ask me, but you don't have creditable coverage for Part B Bravo, but you do have creditable drug coverage. Now, similar conversation here, right? Some veterans are going to have copays for their medications, others are not, all depending on their priority group. So same type of conversation that you have with most of your clients, right? Hey, generally they're going to start telling you what prescriptions they take, what they pay for those prescriptions. So you want to have an idea of what that looks like. Even for those veterans who pay copays for their prescriptions at the VA, it's really robust coverage in the sense that the copays are very reasonable. You can see what they are listed on the screen there. And they have a $700 annual cap, which that's really a max out of pocket in our world. So they're not going to pay more than $700 within a calendar year for their prescriptions through the VA. All that being said, you want to make sure that your conversation around their Medicare needs are probably all-encompassing. And when I say all-encompassing, I mean you want to look at MA-only plans, but you also want to look at MAPD plans. Even though they have drug coverage through the VA, they still can have that option of having additional separate drug coverage through an MAPD, as an example. And there's a few reasons they may consider doing this. First and foremost, and I'll expand on this on the next slide, flexibility. The ability to go get a prescription filled at a local pharmacy. Having that flexibility is something they might be interested in. Formulary options could be a reason. So it's not super common, but they could be taking a very specific medication or want to take a very specific medication, and maybe the VA doesn't cover that medication. And then cost savings can be another one. If they're only taking generic medications and they're paying for all of those generic medications, maybe they're paying for those generic medications, never hitting that $700 annual cap, but hey, if we put them on an MAPD plan with Humana as an example, and they got all those generics through mail order, through Centerwell with us, they'd pay $0 for all those same prescriptions. And we might save them money on their generic medications that maybe they're paying for at the VA. So there's a multiple reasons why they would consider having separate additional drug coverage through an MAPD plan. So when we're talking to them about Medicare Advantage options, we really want to look at all the options and then start to narrow it down depending on what their prescription drug needs are. I already mentioned that flexibility, the ability to go to a local pharmacy and get a prescription filled. But generally, if they go see a doctor entirely outside of the VA healthcare system, so if they had original Medicare and just made their own appointment to see a doctor, or if they have an MA only plan and they use that plan to go see a doctor outside of the VA healthcare system, if that doctor writes them a prescription, generally speaking, there's always exceptions, but generally speaking, they cannot just take that prescription to the VA, drop it off, and get it filled. they generally have to talk to their provider at the VA. The VA has to confirm that prescription is needed, and then they kind of have to re-prescribe it through the VA. So if they want that flexibility outside the VA, if they see doctors outside the VA on a somewhat regular basis, then we may look at an MAPD plan just to ensure they have that flexibility getting a prescription filled outside the VA. And here's something that's pretty cool that last thing I'll mention about prescription drug coverage. Because veterans have creditable drug coverage through the VA, if a veteran who is 70 years old, who's only had Parts A and B of Medicare and VA healthcare since they were 65, if that veteran wants to sign up for an MAPD plan for the very first time, they will not pay a late enrollment penalty for Part D drugs because they've had creditable drug coverage through the VA. So they could sign up for an MAPD, again, for the very first time at 70 or 71 or 68 or whatever that might be, as long as they've had VA healthcare since they've been Medicare eligible. So they have that option should they want to do it if that MAPD is a better fit. For a lot of veterans who go to the VA for everything, get all their prescriptions through the VA, don't pay any copays for their prescriptions. For a lot of those veterans, they maybe lean towards that MA only plan because it fits their needs and maybe has some more additional benefits that they're really looking for. But again, you want to talk about all plan options to include MAPD plans when discussing Medicare Advantage with those veterans that have VA healthcare. Now, in my opinion, one of the very important things that you want to discuss when talking about the value of Medicare Advantage, and this is going to be whether it's MA only or MAPD, it doesn't really matter, but emergency care, copays for emergency care, max out of pockets on plans, that's an important talking point, in my opinion, as it relates to the value of Medicare Advantage and not just having original Parts A and B of Medicare. If I'm a veteran and I get in an accident or I injure myself doing work around the house or whatever the case may be, I'm going to go to the nearest emergency room. That's what I should do. I am supposed to notify the VA within 72 hours that that's happened. And technically speaking, if it's not what the VA considers service connected, meaning my reason for going to the emergency room isn't related to a health condition I have that was caused by my service in the military. So if it's a car accident, if I fell down the stairs, if whatever it is, if it's not service connected, I then also do have to meet certain criteria the VA sets forth in order for the VA to cover the cost of that emergency care. That can be for ambulance services as well. We, of course, would hope that a veteran would never find themselves in a situation where the VA would not cover them at a non-VA facility for emergency services, emergency care. Hopefully that would never be the case. I have heard of cases, unfortunately, where they have been on the hook for that. It's not very common. It's somewhat rare, I would say, but it does happen from occasion to occasion. But having a Medicare Advantage plan, having a copay for an emergency room visit, having a max out of pocket, those are things that are there just in case they need them. Hopefully, the VA is always going to be there. It's always going to cover everything. They're never going to have an issue. But just in case, if they're traveling, if they're visiting family, whatever the case may be, they know they have this Medicare Advantage plan. They know they have coverage for emergency services should they need them. And to me, that is the value. One of the biggest values that Medicare Advantage brings to them is knowing they have that peace of mind of having coverage outside the VA. Even if they only look at it as a backup, it can be there for those things. Now, another piece, another wrinkle that got thrown into how VA healthcare operates years ago was called the Choice Program. More recently, in 2019, it was rebranded the Mission Act. Nowadays, you probably even more so hear it called the Community Care Network. But basically, what this slide is meant to let you all know, to demonstrate, is that the VA does contract with providers in the community. So what that means is the VA has doctors that are in the VA's quote unquote network that they can refer veterans to in the community. So I live up in the Cleveland area. They could refer a veteran to the Cleveland Clinic, as an example, if they contract with the Cleveland Clinic. And if they meet the criteria that requires them to be referred to one of these community care providers, it could be based on how far they have to drive, time-wise. It could be based on how many days they would have to wait. to wait to see a doctor at the VA. It could just be based on the fact that the VA doesn't have the type of doctor that they need to see. But if they meet any of those criteria and then the VA refers them to one of those community care providers, it's covered just as though they're going to the VA. Meaning if they would normally pay a copay for that service at the VA, that same copay would apply. If based on their priority group, they normally would not pay a copay for that service, then no copay would apply when they see this provider who's a contracted provider. This is good to understand as an agent for just a couple different reasons. One, it'll help you understand maybe what you're hearing. There's a chance you've already heard this or you will at some point, a veteran telling you, well, I don't need any other coverage. I can go see any doctor I want to see and the VA pays for it. It's not that, generally that's not entirely true, but what they're probably telling you is that the VA has been sending them to local doctors at non-VA facilities and the VA has been paying for that. So that helps you understand what's happening when that veteran is telling you they can already go see other doctors. The second reason you want to know about that is because if you do ultimately sign somebody up for a Medicare Advantage plan as an example, and they are utilizing community care doctors through the Mission Act, it's important to let them know that when the VA is referring them to a local provider, they should not be giving that local provider their other healthcare information, their other health insurance information, their Medicare Advantage specifically information. Because if the VA is sending them there, then the VA is the one that's going to pay for it. It's very important that they understand that, because if the VA then, because it's maybe quicker for the provider, if the provider bills the Medicare Advantage plan when they should have billed the VA, that can be a pretty lengthy and arduous process to have reversed, have the copay that they may have paid reimbursed to the member, and then have it rebilled back to the VA. So we want to make sure that the veteran knows, hey, if the VA is referring you to a local doctor, that's great. Continue to utilize that, continue to see those providers. But if they're asking you for your other health insurance, you should let them know that the VA is the one that sent you here and the VA is the one that they should be billing. So I'm going to close out VA healthcare and Medicare Advantage here. I've already spoken to a lot of these topics, I believe, but we'll just kind of reiterate a few things and then we'll transition to our last couple topics here. But again, really important to understand VA healthcare and Medicare, VA healthcare and Medicare Advantage, they're completely separate. They do not coordinate. There's no primary or secondary. Having a Medicare Advantage plan will not disrupt or take away a veteran's VA healthcare, whether that's an MA only plan or even an MAPD with, again, additional separate drug coverage. They can have both of those coverages, that being their VA healthcare benefit and their Medicare Advantage plan side by side. Some veterans, and this has become less and less an issue, but some veterans would get hesitant around having a Medicare Advantage plan because the VA does ask, do you have other health insurance? And some veterans kind of jump to a conclusion that they're asking for that because if they find out they have other health insurance, they're not going to let them go to the VA anymore. But that's not the case. They ask for other health insurance because the VA can bill some types of private insurance, employer, individual coverage as examples, and it helps the VA offset some of their costs. They can't bill Medicare and they can't bill a Medicare Advantage plan, but they don't necessarily distinguish what types of other health insurance they're asking about. They just broadly ask that question. So if a veteran is nervous or worried about having a Medicare Advantage plan because of this issue, you can reassure them that, hey, enrolling in this plan is not going to impact your eligibility and your ability to use the VA healthcare system. It's separate. It's outside of the VA. It's additional benefits and options and coverage outside the VA healthcare system. And that is one of the many things on this last slide that you want to talk about when you're really trying to hopefully help that veteran understand the value of Medicare Advantage, the value of the combination of VA healthcare and Medicare Advantage. We talked about emergency services. Generally speaking, even with the community care network at the VA, having a Medicare Advantage plan is going to give them more options outside the VA. I think especially for those that travel, if they're visiting friends and family, taking road trips, whatever the case may be, hey, you have this plan. It's going to give you options to not just for emergency coverage, but to schedule a doctor's visit. Like with Humana in Ohio, our HMO is a national network. So even if they're on our HMO plan In Ohio, if they're traveling to Tennessee or Florida or Georgia or wherever, they can still schedule a doctor's visit. PPO, they can do that as well, obviously, right? But more access to providers, more providers. Second opinions can be an issue for some folks. It gives them the ability to get that second opinion outside the VA if they want to. And then formulary options, which we discussed earlier, for those that maybe an MAPD plan is a better fit. Savings opportunities. Obviously, a lot of these folks, they look at Medicare Advantage as kind of a backup, a second option, extra benefits. So yeah, admittedly, they're going to look at things like a Part B give back. They're going to look at dental coverage. They're going to look at OTC. They're going to look at gym memberships. They're going to look at all those additional benefits the plans offer, because most veterans don't get dental through the VA. Most veterans, if they want dental at the VA, they have to pay a monthly premium for it. Only a select few veterans get that no cost dental coverage to the VA when they meet certain criteria. So dental's a big one. They get hearing and vision, but extra hearing and vision is not a bad thing. And obviously Part B givebacks and gym memberships and OTC allowances and all of those extra benefits, they can really add up. And truthfully, they can almost just take advantage of those extra benefits if they want to, and then just continue to utilize the VA healthcare system if that's where they're comfortable. But it gives them those care options outside the VA. It gives them those additional benefits outside the VA without impacting their VA healthcare. So hopefully that makes sense. I don't know, Bob, and I don't know if there's any questions that I need to address or anything like that, but
There are, I think, a couple of questions. Slide decks. So you're asking if this is something that's available for agents. Is this an agent-approved slide deck, or is this one for you, Aaron?
it's agent facing only. But what I have, Bob, is I have we have a frequently asked questions PDF document. It basically encompasses what I've talked about kind of in more detail in an FAQ format. It's a lengthy document. I won't lie to you, but it's a PDF. I'll send you that, and then I'll also send you our healthcare resource list for veterans. That is more of a, hey, here's phone numbers, web links, points of contact. So like if they need to help a veteran or a spouse with, getting to the right place, contacting the VA, contacting TRICARE, whatever it is, right? It's a quick cheat sheet of those. So I'll send you those. What we do have that's kind of consumer beneficiary facing at Humana is we do have a Medicare 101 for the veteran community that is CMS approved and that agents can use. So if you're working with a local veteran organization, a VFW, an American Legion, whatever it might be, right? And you have an opportunity where you think, hey, I can get up in front of a group of 5, 10, 20, whatever veterans, we do have that pre-approved, CMS approved presentation that's member facing. You just have to be contracted with us and certified, and there's like a quick seminar certification that's like 10 minutes you have to do, but that's about it. So that is available to agents as well.
Another question here. I think this was talking when you mentioned some things with the copays. There's a question of VA copays for $8. I'm guessing this was on the prescription drug part of it.
Yeah, I was showing the 90-day copays. So yeah, like tier 1 I think is $8. But I had the 90-day supplied copays up there.
Makes
But
sense.
yeah, there's different copays for different priority groups and different levels of prescriptions. There's only 3 tiers within the VA healthcare system on their drug coverage. So some agents will say, where's tier 4 and 5? They just don't exist within the VA. They break their medications into 3 tiers. TRICARE for Life and Champ VA. So don't forget everything I just said about VA healthcare. I don't want to say it that way, but we're going to transition now. And remember, there's 3 types of healthcare we're discussing today, and they're all separate. So, and I don't blame anybody because this is a somewhat niche opportunity, a segmented space within Medicare. But a lot of times what I hear from agents is everything is quote unquote VA. We're done talking about VA healthcare for now. We're going to transition to the next 2 types of healthcare, TRICARE for Life and Champ VA. I intentionally talk about these 2 topics right back to back of one another because they're almost identical in how they work with Medicare and Medicare Advantage. So once we get through TRICARE for Life, Champ VA should hopefully be a breeze because we've kind of already talked about it. We'll just reiterate some things. But let's talk about TRICARE for Life, which is the most common question, topic, phone call I get from agents is generally around TRICARE for Life. So TRICARE, if you can for a minute, forget the words for life. TRICARE is for active duty, retired military, and their spouses. So if I join the military at age 18 and I retire when I'm 40, which you can do, obviously, if I retire from the military, that's the key thing. I retire from the military. myself, my spouse, my dependents, my children, we can keep TRICARE. But I'm not on what we call TRICARE for life quite yet. I'll talk about that transition. So if I'm 40, 45, 50, 55, me, my spouse, my kids will age out in their 20s, but we'll maintain TRICARE as retirees. Once we become eligible for Medicare, and if I, as the veteran, become eligible first, or my wife does first, it happens for each of us individually. But once we become eligible for TRICARE for life, that means we're now Medicare eligible. And all TRICARE for life really means is that Medicare is primary and TRICARE is secondary. So remember, if you're talking to a TRICARE for life beneficiary, meaning somebody who retired from the military or the spouse of somebody who retired from the military, and they say they're on TRICARE for life, Medicare is always first, TRICARE is always second. So Medicare first, TRICARE second. It will always work that way. There are no exceptions. Medicare is always first. So let's just talk about what that looks like with just original parts A and B of Medicare. It basically acts like a med sup. They are responsible for their own Part B Bravo premium. So they will pay their own Part B premium. That is their responsibility. Not all of them are really happy about it, but they have to pay for their Part B. And they must do that. They must take Medicare Part B as soon as they're eligible, because if they decline any part of Medicare, they cease to have TRICARE. They don't have the option to say, well, I'll not take Medicare and just continue to just have TRICARE. Not an option. If you want to keep using TRICARE, it can only be a secondary coverage once you're eligible for Medicare. So you have to sign up for Parts A and B, and you will pay your Part B premium. But once you do that, it's pretty amazing, great coverage, which makes sense. You served 20 plus years in our military in most cases. You've earned it. Anything covered by Medicare and TRICARE, you're not going to pay anything out of pocket for it. You can see any provider who accepts Medicare. And the cool part is the billing between Medicare and TRICARE is pretty much automatic, seamless, happens kind of in the background. And on top of all those things, they already have creditable drug coverage built in, managed by Express Scripts. Has a $3,000 max out of pocket, no coverage gap. They can get Express Scripts mail order pharmacy prescriptions. And they do also have access to 40,000-ish retail pharmacies that Express Scripts contracts in network, quote unquote, throughout the country. So it's like a med sub with built-in drug coverage is basically the way you think of TRICARE for life with original Medicare. So let's just talk about why they're interested in a Medicare Advantage plan. It's not because of the copays. It's not because of the network. It's not any of those things. It's because of the extra benefits. They don't get dental coverage. They don't get vision. They don't get hearing. They don't get Part B give back. They don't get all those extra benefits now that Medicare Advantage has. And those are the things they're interested in. And they absolutely are allowed to sign up for a Medicare Advantage plan to gain access to those extra benefits. But if they're going to do that, we have to talk about how it's going to work. So that's what we're going to focus on this next slide, is kind of the three main pieces of information you need to talk through to determine if it really is a good fit for that TRICARE for life beneficiary to go on a Medicare Advantage plan. So this is, I think, the question that was kind of being asked, Bob, a little bit ago, and that's the provider's office billing. When they sign up for a Medicare Advantage plan, that is now their primary coverage, right? Medicare is always first, TRICARE is always second. So that still applies with Medicare Advantage. That automatic billing between Medicare and TRICARE, once they sign up for a Medicare Advantage plan, that automatic billing does not exist anymore. So it's going to happen at the provider level, at the provider's office. So they're going to need to request that their provider bill the Medicare Advantage plan first, and then secondarily, in a sense, balance bill TRICARE, which, to make it even a little bit more complicated, unfortunately, happens through a third-party administrator, Wisconsin Physician Services. They're the ones who manage all the claims between Medicare and TRICARE. So the provider's office needs to be able and willing to balance bill TRICARE through Wisconsin Physician Services, so that copay they would normally pay gets paid to the provider by TRICARE. If for some reason a doctor's office, a provider's office is saying they're not able or willing to do that, to do the secondary billing of TRICARE through WPS, then the member the beneficiary has 1 year from the time of service to submit for reimbursement of any copays they paid. That's done by submitting and filling out a DD 2642 reimbursement form to Wisconsin Physician Services. So this is a change. We need them to understand. You got to be very clear with them. Make sure they understand, hey, you can get all these extra benefits on this plan, but you're going to need to make sure you're working to coordinate your billing with all your doctor's offices. And there could come a time potentially when you have a provider who's not able to do that billing for you. In that instance, you're going to have to submit for reimbursement. They have to understand this, and you have to have this conversation so they understand how the coverage is going to work. Their TRICARE for Life, that is, with the Medicare Advantage plan as being primary. The second thing you also need to discuss with them is any network that's involved, even a PPO. So obviously a PPO gives them more flexibility. Also, a lot of times, you technically speaking can go in and out of network. But even with the PPO, which is probably what I would lean towards if you're talking to a TRICARE for Life beneficiary, they need to kind of verify two things. One, if they go out of network, staying in network is going to be the easiest, right? But if they go out of network on a PPO, one, they need to make sure the provider will accept and bill the plan, because if they won't accept their Medicare Advantage plan, then it's not going to do them any good to see that provider, because they're going to get stuck with a lot of that bill because Medicare has to pay first. Secondarily, if the out-of-network provider is willing to accept the plan, then if, as an example, if it's 50% coinsurance for this service out of network, they probably want to check with Wisconsin Physician Services, TRICARE, before any services are rendered to make sure that they're going to pick up the entirety of that cost. There can technically be allowable limits. So if they're going out of network, and depending on what that coinsurance percentage is, they probably want to check ahead of time just to make sure they're not going to be paying something out of pocket because of any allowable limits. So the two main things that we've talked about so far, that if they want the additional benefits of Medicare Advantage that you need to discuss with them, are the change in the claims and billing process and the network that's associated with the plan and how to navigate that. And then the last thing I'll talk about is the drug coverage. Now, in my opinion, generally, if you're going to enroll somebody in a Medicare Advantage plan, I'm going to lean towards an MA only plan. I'm not going to probably look at an MAPD, because they already have creditable drug coverage through TRICARE, through Express Scripts. If we put them in an MAPD, that becomes their primary drug coverage. We introduce, generally speaking, a higher catastrophic cap, a coverage gap that doesn't exist already, a primary and secondary billing, having to utilize a pharmacy that's in network for both the MAPD and for Express Scripts, and you not having any real way to discuss how their prescriptions are going to ultimately come out as it relates to cost, because we don't have a way to look that up in terms of how both drug coverages are going to coordinate. So unless there's a very specific reason, unless it's the very rare dual SNP beneficiary or TRICARE for Life beneficiary who's dual eligible, unless they have a specific reason they feel they need other drug coverage, we're probably going to steer clear of MAPD plans and look at an MA only plan to not create any issues with their already existing drug coverage. And having that MA only plan should not in any way interfere with or stop them from being able to use their drug coverage through Express Scripts. It won't interfere with that because it's an MA only plan. But ultimately, what I try to say here is, if they're not okay with understanding how the claims process is going to work, or needing to potentially coordinate with their doctors on balance billing, or concerning themselves with any type of network, PPO or otherwise, if they're just generally speaking not quite understanding how this is going to work, if it's just not a good fit, right? This is a population that we probably don't want to push too much if they're hesitant about it. But on the flip side, if they're okay with these things, if they understand how they're going to need to navigate it, if they're really excited about the additional benefits the plan's going to offer them, and if you're comfortable that they're understanding how all of this is going to work, and what I would also say is they're going to call you if they have an issue and not customer service, because that's where it can kind of go sideways. Make sure they're calling you first. But if those things all align and this is a good fit, they can absolutely enroll in a plan. We just want to make sure it is for the right reasons and it's eyes open, and that they really understand how everything's going to work together once the Medicare Advantage plan becomes primary, as opposed to just parts A and B of Medicare. So That's what I'll say about TRICARE for Life. It's not always a good fit for everybody, but because of how significant the additional benefits and the plans are nowadays, it does make sense why so many TRICARE for Life beneficiaries are interested in these plans, because they do provide a lot of value in terms of additional benefits, dental, vision, hearing, all the things we discussed, right? So it makes sense, but we want to make sure that it's a good fit. And I'll close out by saying the same thing as it relates to Champ VA, which I'll go through a little bit more quickly because this will be a lot of reiteration. But the last type of healthcare we'll talk about is Champ VA very quickly. So we talked about VA healthcare, which is just for veterans. Then we just talked about TRICARE for Life, which is for retired veterans and their spouses. Now we'll talk about Champ VA, which is specifically for the spouses and dependents of veterans. So Champ VA is not actually for veterans. It's more so for spouses and dependents. And for our purposes, it'll really be spouses. But basically, if a veteran meets any one of the 4 criteria listed on the screen here, then their spouse and their dependents are going to be eligible for Champ VA. Now, dependents are going to age out in their 20s, but spouses will maintain Champ VA up and through Medicare eligibility. And once a spouse who has Champ VA becomes Medicare eligible, this is going to look very familiar. Same conversation we had around TRICARE for Life. That's where hopefully this becomes a little bit easier, and we start to understand and feel a little more comfortable with this. They have to sign up for Parts A and B of Medicare, Medicare primary, Champ VA secondary, any provider who accepts Medicare, no copays or coinsurance for services covered by both Medicare and Champ VA, automatic billing between the two, $3,000 max out of pocket on their drug coverage, which is creditable drug coverage, 66,000 retail pharmacies they can see. So very similar, just some slight differences because this is now Champ VA compared to TRICARE. So it's the exact same conversation for all intents and purposes when it comes to Medicare Advantage. They want the additional benefits Medicare Advantage offers. They want dental coverage, they want vision, they want hearing, they want OTC, they want Part B give back. Those are the things they want. And it's the same conversation you need to have with them as TRICARE for Life. One, the claims process. They need to make sure they understand. You need to make sure they understand, hey, you can sign up for this plan, but you're going to need to talk to your doctor's offices to make sure they're billing both your Medicare Advantage plan first and Champ VA secondary. Remember, always Medicare Advantage first, Champ VA second. If not, if the provider can't do that, again, there are reimbursement forms that they would have to fill out and submit to be reimbursed for their copays, but they need to understand and be aware of that. Network, same conversation around network. PPO is probably the way I would lean. If you go out of network, which you have the right to do on a PPO, you can do that, but one, you got to make sure that out-of-network doctor is going to accept the plan, and secondarily, depending on what that out-of-network coinsurance is, you probably want to check before you have services rendered to make sure that Champ VA is going to pick up the entirety of that out-of-network service. And then the last thing I'll mention, and again, reiteration here, is the drug coverage, right? They already have creditable drug coverage. So putting them in an MAPD plan probably doesn't make sense. We're introducing a higher catastrophic cap, we're introducing a coverage gap. Probably doesn't make sense to do that unless there's extenuating circumstances. Again, the rare one being if they're dual eligible, I'm going to treat them like any other dual eligible beneficiary, and we're going to look at a dual eligible plan. Or if they are telling you they have a specific reason they think they need other drug coverage. But outside of that, we're probably going to lean MA only. And same conversation here. Is it a good fit? Do they understand how it's going to work? Do they understand how the billing and claims process works? Do they understand how to navigate the network? Are they okay with those changes? Because with those changes comes a good amount of additional benefits. If it's a good fit, we can enroll them. But if we don't think it's a good fit, if they're not comfortable with how things are going to work on that MA plan, then we probably don't want to push them into a plan, because ultimately, if it's not a good fit, if they're not comfortable, that's just going to be headaches and a bad experience for them, and ultimately as you as the agent, and we want to avoid that, obviously. So we only want to do it when it really is truly a good fit because of all the extra benefits that the plans may offer to them. And then last thing I'll just mention as it pertains kind of to Humana is, we have some pretty unique relationships with veteran service organizations, 3 of them listed on the screen here. We've had these relationships for many years, especially the VFW and AMVET. So, we do this training because it's important for you as agents to be able to help veterans in the Medicare space, but also because, we're truly invested in working and supporting these veteran organizations that support a lot of the needs that the veteran community has. as a whole. And then these are the resource documents I mentioned, Bob. So I'll email these to you so they can be distributed out to your agents so that they have those to save. And we also have a TRICARE for Life and CHAMP VA checklist. So it's something like if you're signing up a TRICARE for Life or CHAMP VA beneficiary on a Medicare Advantage plan, it kind of is a short checklist to make sure you talk about those important things we discussed. And then the last thing, and I promise I'll stop talking, I know we're a few minutes over, on the FAQ document, on the left-hand side of the screen, it's just one page example of that document. You're going to see in the TRICARE for Life and in the CHAMP VA sections, it's going to say enrollment not recommended on a lot of the questions and answers. Excuse me. Our compliance teams, our legal teams, they take a pretty conservative approach to this space. So don't be scared about that. It's just when we broadly communicate to thousands and thousands and thousands of agents, not all of whom have gotten this training, they take a more cautious approach, and a lot of times they have that not recommended language because they want to avoid an agent enrolling somebody who doesn't truly understand how it's all going to work. So I don't want you to think that's counter to what I talked about today. Again, with those TRICARE for Life and CHAMP VA beneficiaries, we can enroll them if it is a good fit. We just want to make sure it really is a good fit, and we explain all the details of how it's going to work. So apologies for going a couple minutes long there, Bob. I just wanted to make sure I got those last few things in.
And just a heads up, everybody that's on the call, I know some questions have been coming through about getting the information Aaron's talking about. I'll make sure that once I get that information, we'll get that pushed out to everybody on the call, all the FAQs and whatnot that Aaron is referring to. Again, we know there's a lot of great information. I'll make sure I get those documents forwarded out to everybody on the call today. And again, we do appreciate here at Pinnacle everybody taking a couple of minutes to join us today. So Aaron, thank you again. Very much appreciated. Everybody on the call, have a great rest of your day, and we will hopefully talk soon.